We've done a lot with community awareness. I'm sure some of you have seen a red parking meter out and about. I'll be happy to share more about that. But, the Parking Meter Initiative was another great collaboration between the Downtown Denver Partnership and Denver's Road Home to say, let's unite on this one, that it's not in our best interest to give money to panhandlers. I had somebody email me yesterday saying, is Denver's Road Home encouraging people to give to panhandlers? I will be very, very clear that we ask people do not give to panhandlers, that there is a much better way to help the homeless, that we can help the panhandlers move into housing, but by giving them money, it's not solving anything, and in many ways is not only not helpful to the community, but definitely not helpful to the people that we're giving the money to. And so the Parking Meter Initiative was one way for us to help engage and educate the community. The mayor's pajama party, bless the man, every year dresses up in a ridiculous pair of red pajamas that his mom made him when he's in college. I put it on his calendar every year. He willingly goes, and we this year, during one of the most challenging economies of my lifetime, the year before we had raised approximately $165,000. Denver responded this year, and we raised $500,000 at the mayor's pajama party to support the initiative. And so when people say, does the community still believe this is going to happen, my message is absolutely, that not only is that clear in the data that we've got, but it's definitely clear in the contributions and the support that this community continues to show. I think that our biggest challenge as we move forward will be looking at our numbers. That I think that we're in an economy right now that when the Homeless Commission initially moved the plan forward, there was nobody who had anticipated what we're up against this year. You have a city that is projecting $120 million in shortfall. You have a job loss that is significantly impacting our homeless. You have a foreclosure rate that's significantly impacting our homeless. There's never been a more important time for us to respond. The new administration, I was in DC yesterday, has been unbelievably, is very aware and very supportive of what the mayor is doing here. And I think we're going to see that in some of the prevention dollars and the rapid rehousing that we'll get in terms of the stimulus dollars to make sure that we get as many of these families who are at risk of becoming homeless or homeless back into housing as quickly as possible so that we don't reverse the progress that's been made with Denver's Road Home. So I'll leave you with this thought. I think that it summarizes what Denver's Road Home was all about, is that we've got to get smarter about the way that we do business as government, but across sectors. How are we collaborating? How are we working together to make sure that we're not duplicating services, but really maximizing the benefit that our foundation community, our Mile High United Way, our private sector can do to really impact change in our community. And so on that note, I know that we have a few minutes for questions and answers, and so I'll open it up. And I just really do want to say, 4 years into this, I am so grateful that the community is still willing to hear this story, that we have much more work to be done, and I will beg, barter, plead, and steal that this community continue to talk about homelessness and keep this on our radar screen. Thank you. Sorry. Time for questions? I have this gentleman and then over here. Sure. The decrease in emergency services? Or the Colorado Coaching for the Homeless one? I was on that one. Not that one? Sure. You're right. Sure. Yes. Yeah, no, I actually really appreciate the opportunity to defend the number, and we spent about a year defending it, and City Council was probably the toughest audience to defend it against, because we were one of the first cities in the country that we actually took the cost savings that we were seeing from our hospital and our detox and reinvested them in new housing. And that Renaissance building that I'm talking about, that 100 units of housing, we're estimating right now is saving the city about $1.5 million a year. That when we went to detox, we actually had the most tangible evidence that in terms of, as any city gets bigger, detox has to budget for increases in beds. that they are actually able to bring their budget down by $400,000 in 2007 because they didn't need the beds because the census was so low. And the census was low because we could tangibly show that fewer people were going into detox. That we probably made there's a number of cities that are trying to do the same thing that we did, that we actually, in the midst of always it being a challenge, that if you have fewer homeless in the emergency room, does that really actually save money? We're actually able to have tangible evidence to show it. The city council was impressed enough with it that they actually invested another $30 million to create 5 new housing developments for the homeless that will create about 432 new housing units specifically for the homeless through those cost savings. So I will go back and say that, you know, our jail census, as we're looking at those numbers, we'll continue to monitor them. I think that the community should continue to ask us tough questions on it, because the cost savings is a little bit hairy in terms of how do you reinvest those. But I do think that there's some pretty compelling data, that our arguments have all been based on our data, not, oh, this sounds like a good idea and it probably is working, that if it's not, if we can't prove it, then it's not real. Yes, sir. Sure. No, I appreciate the question, and it's been a basic tenet of Denver's Road Home is to make sure that all of our outreach and our housing efforts are tied into providing more medical services, substance abuse, and mental health services. And so the Colorado Coalition for the Homeless is actually getting a new federal grant that will expand their ability to serve the homeless with the medical services, but it's also making sure that the Colorado Coalition for the Homeless is tied into Bayard Industries that's doing our employment support, so that we don't just provide people with medical care. That does them no good if we don't provide them with housing and a job. And so we're really trying to work with the health centers to link up those services, to make sure people know what services are available, and to make sure that we use them as strategically and effectively as possible. Yes, sir. Well, my comment would be the mayor and I would both be absolutely delighted if you chose to engage us in any way, shape, or form. And what's moved Denver's Road Home forward is groups and organizations like you all that say that this continues to be an important part of the community. And so we're just grateful to be considered for that. We know that the mentally ill and especially with the chronically homeless is one of the biggest challenges that we've got, and it's really making sure that every one of our, especially as we're building our relationships with our communities, that one, as we develop our housing developments, that we need to make sure that people have access to medical care, mental health care, that we make sure that people have the psychotropic medications that they need to be able to sustain. If you look at those numbers from the Colorado Coalition for the Homeless, 80 to 85% of our chronically homeless are mentally ill. If you don't connect them with mental health services, you're not going to get those outcomes. So on that note, I do want to, as we're almost out of time, I do want to leave you with a story, and then if there's time for more questions, I'll be happy.